You have no idea how long it took me to get my phone in here. And even then, it's cutting off my head. Ma! If you know me, you know I'm a big advocate for mental health. We have no health without good mental health. But that's really easy for me to say with all the privileges I have with regards to getting help with my mental health. My privileges include, but are not limited to, thin privilege. When I went to go and see my doctor, I wasn't denied any medication or treatment because of the size of my body. Whereas a study published by The Observer in the UK in 2013 found that 54% of doctors agree and supported limiting medications and treatment for those in larger bodies. Racial privilege. I was offered medication immediately upon seeing a doctor for my mental health. Whereas here in the US, in a 2014 report published by the Robert Wood Johnson Foundation, it was found that 30 to 40% of Latinos and African Americans have poorer health outcomes than their white counterparts. Healthcare privilege. In the UK, if you don't know, we have the National Health Service, which is a free healthcare, essentially. I was able to see a doctor on the day that I needed to see a doctor, free of charge. Compare that to here in the US, where approximately 28.9 million people don't have health coverage. Cisgender privilege. I was able to see a doctor without having to battle with their preconceived notions of my gender. However, according to the 2015 US Transgender Survey, almost a quarter of transgender folk avoid healthcare due to anticipated discrimination by their doctor. And lastly, but certainly not least, I have socioeconomic privilege. In addition to being prescribed medication by the NHS, I was also prescribed some free therapy sessions. Once I completed these free therapy sessions, I was able to continue my therapy in a one-to-one setting privately, which sessions tend to go from anywhere about $60 to $200 per session. Which compare that to the National Council study, which found that about a quarter of Americans reported between having to choose between getting mental health help and daily necessities. So whilst I'm adamant that it is important to destigmatize mental health, it is also important to recognize our own privileges when it comes to doing so.